Let's talk about how sauna supports cardiovascular health. Okay, so there's a couple of ways that it does. The first is by lowering inflammation, right? So it's going to reduce oxidative stress. It's going to decrease blood lipids and blood pressure levels. Okay, and it may also help reduce that stiffness that I was talking about in the arterial wall and improve the function of the cells that line the blood vessels. Okay, so this is actually quite interesting because that lining of the blood cells is not that thick. Like the cells that line the blood vessels are actually quite thin. And so this is where we start to see our cholesterol levels start to go a little bit wonky in perimenopause and menopause, our LDLs in particular, and triglycerides. We tend to see those increase quite a bit. And really, this is why if you are doing lipids in your 40s and 50s, you really should know your LDLP, not just your LDLC. So the LDLP is your particle number. And this is going to tell you literally how many particles there are, because as you know, it's really just a game of statistics. Like the more particles you have, the higher the incidence that one of those particles is going to slam into the wall of the arterial lining, infiltrate it, and then create this sort of infarct and this, we'll call it like chaos underneath the lining of the wall, which will eventually form a plaque, etc. So we want to be thinking about all of the ways, so cardiovascular work, zone 2 training, even high intensity intervals, resistance training, all of these things are going to be positively impacting our suppleness of the arterial wall, but sauna use also is another well-documented way to do that. So let's talk a little bit about sauna use and cardiovascular disease. Again, looking at a study, they were following sauna users over, I believe it was 21 years, and I'll link this study in the show notes as well. So they were following these sauna users over 21 years. And what they found was that of the cohort that they were looking at, when we compared the participants who reported one bathing session per week, the risk of sudden cardiac deaths was 22% lower for the individuals who were bathing 2 to 3 times per week. So the baseline was individuals who were doing sauna once a week. Those who did sauna 2 or 3 times a week had a 22% less or lower risk of sudden cardiac death. And it was 63% lower for individuals who were sauning 4 to 7 times per week. So I'll say that one more time. So the individuals who were sauning 2 to 3 times per week had a 22% lower chance of sudden cardiac death, which is a heart attack, 63% lower for those who are sauning 4 to 7 times per week. That is profound. 63% lower if you're doing it 4 times per week compared to somebody who is doing it once a week. So it appears that even the once a week isn't going to do the trick. It needs to be several times per week. Same study looking at cardio. So they're looking at heart disease. Again, the individuals who were bathing 2 to 3 times per week had a 23% lower chance of CHD and 48% lower chance of heart disease if you are sauning 4 to 7 sessions per week. I think that is incredible. Now, it is important for me to say that these studies were done in men, but it is worth noting, like I mentioned before, that the years after menopause, women do catch up to the male risk for heart disease. So I'm not saying that we're little men, but in menopause, we do become, I should say our risks are more male-like, okay?